Good morning, doctors. So now we are at week 5 for our course where we go to medical management. Trust me, it's amazing. Medical management is really nice, and this is one of the part in our course that I know our doctors are confident about their answers because how we think about it. So let's break it down. So you can see a lot of videos like 1, 2, 3 up till maybe number, I know it was a lot, I remember 12. So, but as you can see, the videos are short, like viral is 10 minutes, pregnancy 12 minutes, GIT 40 minutes. So don't think, oh, it's 12 video for this week. No, the videos are short. I try to break it down. Why? Because later on, when you go to the more questions, you will be confused about some medical management emergency. So I tried my best to make it super concise. So you go to a specific chapter to discuss about this specific condition. Okay, for medical management question, I would love you to think about it in 3 steps. When you read any medical emergency question, you need 3 information to answer. If you cannot see the information, look again in the question. First is the medical history. So telling you cardiac patient, non-cardiac patient, healthy patient, diabetic patient, pregnant, HIV patient. So you should look for the medical history. If it's not mentioned, so this patient is healthy. Second is sign and symptoms. Sign and symptoms of this emergency or this patient. And I know all of us are jumping to step number 2, and this will confuse you a lot, and you will know why in the step number 3. So second is sign and symptoms. If you make it sign and symptoms only, it will be super confusing. So let's give an example. Syncope versus hypoglycemia. Exactly. You can spend 100 years reading this and that. It will be the same. Angina versus MI. Take your time. You can read a lot, but like it will stay the same. So you need the medical history, adding with this medical history signs and symptoms, and finally the third and the most important step is the clinical scenario. While doing extraction, after giving freezing, while giving freezing, immediately when the patient see the instrument, immediately after the patient entering into your room. Then, understanding the 3 information, then you can answer. You should make algorithm in your mind. Okay, so this is the management for the cardiac patient, and there is a management for emergency patient, according to this. The tricky part here, and this was my mistake for a very long time, and I regret doing this, I hope you will not do that now. When you read the management, you read the medication for emergency is not like salbutamol. No. Salbutamol, the dose is, the frequency is, this is a step 1. What is a step 2? What is a step 3? When you are going to call 911. So for each emergency, you're gonna think in the 3 steps again. First, the name of medication and the route and the dose. Second, what if this not working? Third, when I will going to call 911. And then you go through all your emergency. I strongly recommend you do your paper, you do your notes, because trust me, this will give you tons of questions in the exam. Tons of the question in the exam of medical management. I know doctors and other courses don't follow this. Trust me, just follow this for your initial study for medical management. You will enjoy it, and then when you discuss with anyone else about the question, you can answer with confidence. I don't want to answer maybe this, maybe that. No, I would like you to go with confidence. As usual, you can download the PDF from here, or you can go to, if you would like to download it at once, you can go to the PDF file, click here, and then medical management. You can watch it, you can download it, you can print it, do whatever you would like to do with it, except of sharing this materials. I hope this is clear for everyone. I don't love any of you to share this material with anyone, and I trust everyone here. Thank you, and I hope you will enjoy this part. I know it's annoying. Trust me, when you go through this setup, I have the 3 steps. I have the 3 steps for diagnosis when I read the question, 3 steps of the management. It will become insanely easy.